Welcome to the Bendigo Health 29th Annual General Meeting for the 2023-24 year. My name's Ava Pieko and I'm the Chair of Bendigo Health and your host for the afternoon. On behalf of our speakers today, Bendigo Health acknowledges the traditional custodians of the land, the Dja Dja Wurrung people of Jara country, and pay respect to their ancestors, elders past, present and future, and to any First Nation people joining us here today. As a health service, we acknowledge Jara have been healing with country for thousands of years. We recognise and respect their culture and the contribution of all Aboriginal and Torres Strait Islander people across the region, and express our commitment to walking together, side by side, on this continued healing journey. We are committed to ensuring we can provide a safe and welcoming place for First Nations people. Thank you for everyone attending on this gorgeous afternoon. It's so beautiful out there. So I thank you for giving up your time and for coming along today. And I also would like to welcome those people online. We hope you're out there somewhere, but thank you for joining us. I'd also like to thank my fellow board members for joining us today. They are an excellent bunch of people, I've got to say. They are committed, they're constructive, and they're always working together to try and help improve the service. I'd also like to welcome Eileen Hannigan, our CEO, our executive directors, the many staff and volunteers who are here today, and special guests from other services that we work with. In particular, Andrew Cooney, CEO of the City of Greater Bendigo, Andrea Metcalf, the Mayor, who's online. Hi, Andrea. Mary Manescu, CEO of Rochester and Elmore District Health. Thanks for joining us. Joe Bradshaw, Director of Communities and Campaspe Shire, also online. Marika McMahon, a past Chair of Bendigo Health and Director of O'Farrell Robertson McMahon Lawyers. Marika was saying she's happy to sit back there and listen and I have to be up here. Also, Sally Curtin and David Richardson from Bendigo Kangan TAFE. Byron Perrin from La Trobe University, and I'm sure there's many more people that I have missed saying hello to. Mandy Hutchinson from Bendigo Community Health, so all our people that we work with out there. We have apologies from Melissa Phillips and David Roseo as our Executive Directors, Lisa Knight, Director of Health Communities, Mount Alexander Shire, Beth Bembo, President of the Auxiliary Bendigo Health. She does an amazing job. Martin Horson, CEO of Mildura City Council, Wendy Lovell, Liberal Member for the Northern Victoria Region, Janice Kelly, Chair of Swan Hill District Health, Marie Edwards, MP and Member for Bendigo West, Bill Appleby, CEO of Wodonga Albury Health, and Bob Cameron, also a past Chair and Chair of Coolabin Water and TAC, I think, does something, lots of stuff. Work safe. So that's that, and I'd like to start off the meeting by recommending that the board accept the minutes of the 28th Annual General Meeting held on Tuesday the 14th of November 2023 as true and correct. Would anyone like to move that? So Ume, and second it, Carol McKinstry, thank you very much. Anybody against those minutes? Any corrections? No, thank you. Alrighty. To all the wonderful staff at Bendigo Health, thank you for your outstanding kindness and care, even when under huge stress. This is a quote from a patient's thank you letter that sums up our community's appreciation for the incredible effort the staff make, day in, day out, week in, week out. No matter what else is going on around them, what else is going on in their own lives, they're always there to care for the community. And on behalf of the board, I also extend that thanks and gratitude, because without our staff and the service they provide, there would be no Bendigo Health. We thought things would get better after COVID pandemic. We thought that was tough and that things would settle and life would jolly on back to normal, but I don't think there is a normal. And in health, this has been a tough year. No doubt everyone's aware of the significant changes and challenges that face the health system throughout Victoria. Patients are presenting with much more complex illnesses. They're much more unwell, they're really, really sick and requiring longer hospital stays. The staff's The staff's adaptability and their ability to deliver timely, safe care inspires and provides confidence to the board and the community. There's been quite a lot of change in the leadership of the organisation. The most major change has been the introduction or the welcoming of our new CEO, who's just been here for a year now. And there's also been a bit of a change in some of our executive directors. We thank the staff that have left to grow their careers because they provided years of dedication to the community, to the service. However, this has also provided the opportunity for new personnel with fresh perspectives to bring growth and expertise. We welcome our new CEO, Eileen Hannigan, who has just celebrated her 1-year anniversary with us at Bendigo Health, and her wealth of experience in health across different sectors and in different states has certainly brought a new approach and depth to the direction of our service. As we progress, there's a sharpened focus on quality, safety and accountability as our key commitments. In 2023, we brought on 3 new board members. I think I did introduce them last year, but we have Craig Neiman, former CEO of Bendigo Council, Professor Carol McKinstry, La Trobe University, and Will Conlon from Bendigo Bank. With diverse backgrounds and extensive local experience and community connections, it's helped expand the skill set of the board and, again, bringing in fresh eyes, fresh ideas and saying, why do you do that? Like, it's always very useful to have someone to not always go with the status quo and to think about what we're doing. It's a bit early, but I'd also like to take this opportunity to publicly thank Dr. Umair Masood, who'll be completing his 9 years on the board in June 2025. His work and leadership with quality and safety has had a big impact on our service, and I'd like to thank you for that. It's a good effort, 9 years. My washing machine broke, my dishwasher broke down a few weeks ago, and it was 17 years old, and as the tradesman said, some marriages don't last that long. So thank you for staying on for so long. This year, we celebrate the long-awaited official opening of the Clinical Services Campus by Premier Jacinta Allen and Bendigo West MP Marie Edwards in June. That was a big project, and for those of you who know it was a long time coming. It's made a great positive impact for the care of patients and improved the work environment for staff, who've got much more opportunity for collaboration and a much nicer workspace to be in. It was a big, big job. The redevelopment, the move, and the patience in waiting for it to be ready. Thank you to all those involved in the project, and in particular the building team. They had a lot on their hands at the time. And we look forward to further improvements, including the demolition of the old towers, which will finish off that project and open up the spaces in the precinct. Other fabulous projects underway include the upgrades to the Bendigo Youth and Prevention and Recovery Centre, otherwise known care centre called Y Park, and the Early Parenting Centre. Recently the board got a chance to visit the Early Parenting Centre. It looks really, really lovely, and it'll provide much needed specialist support for families with children aged 0 to 4 years of age. And that wasn't available in our region before. People would have to go to Melbourne if they had children who are unsettled or having sleeping problems. And so it's so fantastic we can provide that service here in our region. It's taking shape and on track to be open early next year. Despite all the workforce challenges, the staff have been incredible and able to deliver close to 100% of activity targets for the year. Some of our outstanding highlights include our cardiac catheter lab, which is one of the busiest in the state. Helicopter arrivals. I think when the hospital's built, they didn't think there's going to be that many helicopters arriving, and certainly people who live close by didn't think it was going to be as many. But we had 104 last year alone, and it continues to grow. And the interest in nursing careers remains strong, with more than 100 graduate nurses joining the organisation last year. Our staff continue to work on the clinical services plan, with the board endorsing plans for 2 clinical areas, renal and the women and children's services, and there's many, many more underway. So it's great to see those come to fruition and how we can expand our services for our community and for the region. And very exciting, planning and consultation processes are underway for our next strategic plan, giving us an opportunity to review and grow the service we provide for the community and the region. During COVID, we put 2 committees to hibernation. There was the Community Advisory Committee, and that's been reinvigorated. So the community members have provided very effective and constructive feedback, and great work done by board member Katerina Angelopoulos, who was the chair of that committee, with plans to make the committee even stronger in the year to come. And also the Primary Care and Population Health Committee, working closely with other health services, regional subcommittees, and an amazing lot of work done by the Loddon Mallee Public Health Unit. The Loddon Mallee Public Health Unit has put out 2 publications in the last year, a population health plan for 2023 for the Loddon Mallee region, and a climate change and health framework. They're fantastic documents, so if you get a bit of chance to have a look at it on the website, I'd really think it's worth a look. Finally, and I'm almost done, I'd like to emphasise the commitment of Bendigo Health. It's not a hospital, it's not a place you visit it, it's not the buildings, it's actually a group of people. Dedicated, passionate and caring staff, clinical and non-clinical, because it takes everyone to make this work. And I think it's really important for us to remember and continue that we have to support our staff as best as we can, uphold our collective values as a service, and strive to provide a safe, efficient and financially sustainable health service for the future. So thank you. I'd now like to invite our CEO Eileen Hannigan up to continue.
Thanks very much, Ava. Better put the glasses on. I think when I reflect on the past 12 months as a CEO, the one word that comes to mind in arriving in Bendigo, and I can tell you it's vastly different to my last job where I arrived in Sydney, is being welcomed. I was warmly welcomed by everyone. So it's been really quite inspiring and deeply humbled by the genuine care and the unwavering dedication I see throughout the hospital. What's different for me to see is that sense of connection you see here. You know, in Bendigo Health, the patients and staff are often the neighbours, the club members, they know each other. There's a different level of care than I've ever seen before in the many health services I've worked at. And the bond between them is truly amazing. You know, as I said, I've been welcomed, but I've been personally supported by our amazing executive team, senior leaders, the board and CEOs across the region and across regions, and the senior leaders of many of our strategic partners. And all of you I want to thank. What it says to me is there's no doubt it is the support of our community, both in and outside the hospital, that drives our success. You know, when I look across at these photos, on the top left there you'll see Peter Brown. Peter was a patient of ours who had a terrible motorbike accident, and you can see the result of that. But what he's done after receiving compassionate care at Bendigo Health is he's come back and joined us as a volunteer. He works in our rehabilitation ward. He embodies the community and the spirit that I think defines us, providing inspiration to those in the rehab wards that are really struggling to find, you know, to see a point to work further their way forward. He's just one of our 120 volunteers who offer their time and energy to Bendigo Health, bringing warmth and welcome to our clinical areas and making a lasting impact on our hospital community, both patients and staff. We've seen exciting growth in our volunteering efforts, particularly with the Holiday School Volunteer Program, which has been recognised across Australia and won multiple innovation awards. Our volunteering program continues to grow, but I have to say we're always looking for more. You know, passionate, caring people are important to join our team. They're a group of people that it's really, truly difficult to actually find a way to thank in a meaningful manner. You know, for me, people who give their time so generously, to give it to compassion and care of our community is amazing. And our fundraising team has had another successful year. Again, this is supported by our community. Philanthropy is a lot more than raising dollars. Philanthropy enables innovations and new care models, such as the Gobi Wellness Centre. For me, philanthropy often provides that seed funding for proof of concept, empowering our staff to be innovative and fostering that so very important culture of curiosity that you need in a hospital to actually move forward. So fundraising is pivotal. You know, it supports our future innovations, it enables technology investment, and we thank our community for this such generous support. I know Trevor Elliott's going to give us a lot more detail on fundraising, so I won't go into that. Now, I thought I'd touch on a little bit of clinical operations, because I think many people who see the hospital see the shiny building here and don't see the service as a whole. Remembering about 50% of what we are is in that shiny building. We have services from Castlemaine to Mildura, and it's important that we recognise all of those at days like this. I think Ava touched on the fact that this year has been challenging, but the resilience and professionalism of our clinicians has been nothing short of remarkable. Our emergency department this year saw 60,000 visits, over a quarter of those arriving by ambulance. 57,000 patients were admitted and 18,000 surgeries were performed. And the growing number of those surgeries are becoming emergency surgeries, not elective surgeries. Our children's ward admitted 1,600 young patients and we delivered 1,700 babies. You know, don't forget our aged care. We have 268 aged care beds, which was 95% occupied throughout the year, and all of those services maintained a 4-star rating, which is hard with the new aged care standards. The team have designed and planned a new specialist dementia unit, which intends to open next year. Dental, we have in the new clinical services building, we have purpose-built designed dental service with 31 chairs, and our Smile Squad has 4 trucks that goes out regularly visiting our schools and communities. Our mental health service has community centres across Swan Hill, Mildura, Chilka and Castlemaine, giving 101,000 community hours in the last 12 months. That's 10% increase of last year. And our mental health unit at the hospital has provided over 28,500 bed days of care. So there's been over 100,000 outpatient and community allied health appointments, 140,000 appointments provided through our specialist clinics. All of this is just a touch of what we do, and it's all been enabled and made possible by our 5,300 staff and many volunteers. From our clinicians to our support staff, each person plays a vital role in delivering the care. We talk about Bendigo Health being truly a family, and if you look at the second picture down there, you'll see Kate in the blue top with mum and daughters. Kate, you know, Bendigo Health is truly a family, and in spirit and reality, or I'd say a group of families, because as I walk around the hospital, I hear this all the time. You know, at award functions and other things, I hear, well, my mum worked here, my daughter's now working here, so-and-so's in pay office, you know, those kind of things. But this is a typical example. Now, this is, I hope Kate's not here to hear this pronouncement. Ralston, I should have asked someone, Gargiulio Fuller family is one of these, okay, with a long history. Kate became inspired to be a nurse when she looked after her father and saw him cared for by us. She's now passing that passion on to her 2 daughters, while her mother, after her illness in Bendigo Health, is obviously with the red shirt, a volunteer for us. And again, as I said, it's this deep-rooted commitment that we have from the community that makes us so different. We've introduced a lot of new services this year, including water births, natural birthing, heart helper to ensure our cardiac patients are supported at home, earlier physio to reduce our time in hospital, just a few. We've been working closely in partnership with our colleagues across regional hospitals, striving to ensure that we can get the right patient, right time in the right place. There's still a lot of work to be done there, but we're working on it. Across the region, many centres have implemented virtual care supported by their sub-regional hospitals or Bendigo. Home monitoring is being used to reduce unnecessary readmissions to hospital, and in-hospital virtual doctors are being used in our smaller centres to support them increase their capability and capacity. It's a priority for us across our region where we can to keep our people near their community. We've developed partnerships with the Royal Children's to have a paediatric outreach service, the Women's Hospital for IVF, and we've got many other collaborations like these coming, all to improve the care of our community. We still have the challenge, I think. Recruiting senior clinical positions is always hard. I can only thank Simon, who I can see there in the distance, for the hard work he put in recently trying to attract a senior cardiac unit head. After months of commitment and hard work, it didn't come through. But it was an enormous amount of work, and we'll get there on these things. You know, our commitment to overcome the challenges of being a regional centre and attract those kind of people is strong. And when we talk about research, it not only provides us an opportunity to innovate models of care, treatment, it enables regional Victorians to access trial and drugs that are not previously available. With support of our foundation and grants, we will be focused on research and innovation in the future. It not only provides better care, but it supports us in attracting those senior clinicians that want to come and live in the region and have that supportive infrastructure. It also supports that very important culture of curiosity across our service that we need to foster. But we're getting there. In the last 12 months, we've had 131 studies running, of which 51 were clinical trials, and that's a significant increase from 5 years ago. So I'd say it has been a great privilege in leading Bendigo Health. Every decision we make is deeply connected to our community, and it is an honour to guide such a dedicated team in delivering exceptional care. We remain committed to our core values, and we will always support our staff and uphold our mission to provide the best possible care to those we serve. Really, in closing, I want to thank Ava and the Bendigo Health Board, my executive team, or our executive team, and the senior leadership across the region and across Bendigo that have made me so welcome and supported me in this position. Our community, our staff, our volunteers, donors, partners for their ongoing dedication and passion. And I want to reassure you, we are looking ahead with great excitement and confident that together with our community, we'll continue to provide exceptional care. Thanks.
Thank you, Eileen. And with that, looking ahead, I'm very pleased to invite our guest speaker up to the lectern to chat with us this afternoon. It's great to have Associate Professor Janelle Brennan here, and I thank you very much for coming along and taking the time. To have to put something like this together is difficult, and you're a very busy person, so we appreciate it a lot. Associate Professor Janelle Brennan is a urological surgeon and the Director of the North West Victorian Regional Training Hub at Western Rural Health. In this role, Professor Brennan and her team have focused on increasing access to specialty training and improving career opportunities for junior doctors across the Loddon Valley region. She has a Bachelor of Medicine and Bachelor of Surgery with honours from the University of Melbourne and completed her surgical and urological training at St Vincent's Hospital in Melbourne and is currently the head of urology at Bendigo Health. In her spare time, she also runs her own private practice and provides services across many regional health services. But the thing that really strikes me about Janelle, and I've known Janelle for a little while now, is her unwavering passion for training in regional centres. So really leading by example, just to showcase how you can have an excellent career and opportunities and provide, high quality service to regional people. And it doesn't have to happen in a metro centre, that there is a world beyond the metro centres, and, continues to work and focus on how we can do that to attract junior, medical doctors, registrars and fellows, and say we can have a good job, you can provide this fantastic service, but you can also have a great lifestyle. And that goes beyond, because Janelle's very committed to the community and is the first to put her hand up for fundraisers and doing different things, and always knows what's going on. I think the biggest source of gossip in town. Second biggest. But always knows what's going on and is, absolutely connected to the community and region. And it is that theme that we're going about looking forward. So where can we go with this? Because I think there is extraordinary opportunities for living and working in Bendigo and in the Loddon Valley region. So thank you, Janelle. Not really a gossip.
I don't call it gossip, I call it news. Unfortunately, I'm chained to the lectern today. If anyone's heard me speak before, I'm a bit of a TED talker and I like to wander. We didn't organise this very well, and I don't have a clicker. So if I start waving, I'm not waving yet, I'll tell you when I'm waving. That means next slide. So thank you for that very kind introduction. I've learned a couple of things giving speeches. The first is to check you've got the right slides. We're looking good. I'm about to give a talk in a couple of weeks with Phil Tune, the Director of Psychiatry, on head versus knob. You can guess which side I'm on. And I thought, my God, if penis pictures appear, I'll never be invited back. And the other thing I've realised is make sure the title of your talk is not easily understood. So at least you'll have to pay attention for at least 3 minutes. And psychologically speaking, as humans, we love lists. So you're going to have to find out what the 3 E's are and the 4 R's. Watch this space. So when Abba asked me to speak, I was obviously very honoured and delighted. A little less delighted at 2 a.m. when I was thinking, what am I going to say today? But delighted. And we are friends because we are in book group together, which is a very powerful thing. And, Bendigo might have the Sandhurst Club, but we have an all-female book group, and that is power, ladies, that is power. And she asked me, what's your vision? What's your vision? And I thought, what would come to mind? Next slide. And this is what I thought of. This is my vision. I'm driving, I've got the Porsche. Ava is so organised, she knows everyone. She would have got the girls together. We've robbed every bank in Bendigo, sorry to the board member from the bank. And we're going to the Greek islands to drink Aperol spritzers forever. Great vision. Okay, that's probably not what's going to happen. Next slide. So what she really wanted to do was talk to me about my work at Monash and to try and explain it. And I thought, well, you only wanted me to speak for 15 minutes, so that could be tricky. But basically, it's a federal government initiative to look at how we can improve regional medical careers, because we know that we've had rural health services for 20 years in terms of training medical students, and it's been tremendously successful. But yet we have issues, and we have issues because young doctors need research to get to the next stage of their career, which is why we've had this conference running for the last 3 years very successfully. And we know there's such a thing as the leaky pipeline. So Bendigo Health, most of the interns here come actually from Monash, where they trained here. They had a good time here, they stay, but then suddenly they're like, I think I want to do specialty training, so maybe I better go to Melbourne. There's going to be more research opportunities, and even if I don't want to go to Melbourne, I have to go to Melbourne. And before you know it, they've got married, they've had a kid, they've bought a house in Hawthorne East, and their children are going to Carey, and we're never going to see them again. And we know that we have to provide opportunities to keep people here, which is why news gathering, aka gossip, which I wasn't going to talk about today, is so important, so that we can have relationships with people and help them on their journey. So that's the wave of next slide. I feel like I'm back in those lectures again. We know that rural patients do worse. And in fact, many of my colleagues in Melbourne say to me, Janelle, we respect you, but you work in Bendigo. In general, patients' outcomes, particularly in oncology, aren't as good. And they tell me the answer is centralisation. And when I first heard this, I was really excited. And I'll tell you why I was excited, because I live in Bendigo. And you may not know this, but Bendigo is the centre of Victoria. And you may not know that I'm such a loser. I spent one Saturday to go and find this inauspicious landmark and take a photo of it for you to show that we are the centre of Victoria. Now, technically it's Mandarang, I know that, but we're bloody close. So I thought, this is good. Here we are, centre of Victoria. But what I really realised is that we just want to get more and more specialists, because who doesn't want an upper lipologist? I personally, if I ever get breast cancer, I'll be going to a right breast surgeon and I'll be ensuring that they only do the lateral aspect of the breast. Now, as great as that is, it's not really going to help me if I have a heart attack, is it? And the more and more I spoke to my colleagues, this is what I hear. And this is from Nathan Lorenchuk. He's the year ahead of me. He actually was a student here in Bendigo. centralisation of complex urological surgery and understanding the 3 E's. Is it inevitable? And this is particularly important for me because I did do overseas fellowship and my specialty is cystectomy, which is probably the most complex surgery in urology, and that's the one on the chopping block. And what he says in this editorial in the British Journal of Urology, not some, local paper, next, is there are 3 things that are going to lead that. The first is expertise. Surgeons live in Melbourne, fellowship surgeons live in Melbourne, people will want to send it to that surgeon. Equipment. The centre has access to robotic surgery and we do not, so perhaps it should go there. And endorsement eventually just becomes a self-fulfilling prophecy. More and more work gets done in the city, they can produce more and more data because they've got research, so they must be better, even though the quality of the research is terrible. And regulators and governments and even hospital boards will mandate that. And that's certainly been the case in New South Wales. Next slide. But what they really mean is they don't really mean centralisation. Because centralisation means one centre doing nearly all the work. What they really mean is goodbye surgery in Bendigo, but we'll keep doing 5 a year at the Alfred and 5 at the Austin, 5 at Royal Melbourne and 6 at Peter Mac, and you might even have 7 at St V's, because it's all right if we lose our service as long as our big metropolitan colleagues, we've all done fellowships. It seems Ballarat's a special example. They got funding for a robot, so I reckon they could be safe. Next slide. So I've become quite passionate about this, and in fact I've even worn a pink hat at a national meeting and a cowboy shirt to try and produce this, and I even got invited to speak in America about this, and I just wish I had a red hat that said "Make country hospitals great again," but I didn't think of it back then. Because apparently, even if you've got no truth, as long as you believe it, it's enough. Okay, so what I'm really trying to tell my colleagues is that centralisation or excellent outcomes and excellent care doesn't have to just be in metropolitan regions. And in fact, that's where regionalisation, which is what I want to talk about today and something I'm really passionate about. And it's not that we just want to become a mini St V's or a mini Royal Melbourne. We have very different needs. We are geographically dispersed. Our population is different. In fact, there's hardly any research on rural patients. How do we know if they respond the same way? We know that we have one of the highest incidents of prostate cancer in Victoria. Who knows? Maybe it's the arsenic in the gold mines. I don't know. But I do like the poppet head, so it's a small price to pay because I don't have a prostate. But, and I make money out of prostates, but I didn't say that out loud. So regionalisation is the way to go. So what are the 4 R's? And you all thought it was going to be robot, didn't you? No, that's number 5. What I want to talk about today is recruitment, research, relationships and risk, because I don't think we talk about risk enough. Now, I could talk about them and say, yada, yada, this is what the evidence shows, this is what we could do, but I thought what I'd do is storytelling, because it's about 3:30. There's an arched window, and I used to think it was very comfortable about this time of day to start thinking about stories. So if you'll allow the rocket ship to take off, I want to share 4 stories for you from Bendigo Health. And the first one is recruitment. And I spoke to all these people to get their stories. This is Nicola Ewan, who we went to med school together. We both shared the prize in the Clinical Upjohn Award in Clinical Pharmacology, and given that none of us prescribed drugs, well, that was a waste of time, wasn't it? She's unfortunately going to Melbourne. She's still living here to go to the Royal Women's in a few weeks. But her story is very interesting, and I know this story intimately because I've been very involved in their unit. So when she came in 2016, there were 2 staff specialists, 5 VMOs, and they'd have 1 to 2 rotating registrars for 6 months and 1 senior registrar. She leaves 8 years later, I think, with a tremendous legacy. There's now 15 consulting O&G specialists. They're fractional. There are 5 training registrars, and the one that really makes me happy is that 3 of them are Bendigo trainees, i.e. we get to choose them, we get to train them. The old model is 4 years in Melbourne, 6 months, 12 months in Bendigo. This is 4 years in Bendigo, 6 to 12 months in Melbourne. Their house isn't in Hawthorn East. Their house is near Kenny Res. Maybe Quarry Hill. We're very involved in GP obstetrician training, and in fact we have 4 currently working in the Loddon Mallee. And what really pleases me is that the last 8 years there's been 6 senior registrars. So they do a year here, they get a chance to sort of try before you buy. All 6 live in Bendigo. Bendigo. How good's that? I'd have my baby here, except I'm 50 and probably perimenopausal, but that's beside the point. Next slide. So what is that regionalisation effect? Well, the thing that Nicola says, the thing that she's done has been able to bring skills to the region rather than taking patients out. And we all know when you're sick, I don't know how you can possibly have a baby when you don't live in that town, when you've probably got other young children running around and, you know, you're trying to cook food for your husband who can't cook and all those things. It must be almost impossible. But they've been able to come up with solutions that aren't the same. So she says, for instance, in Castlemaine, they want a lot of control over their O&G service. Bendigo Health just provides a governance-assisted model. Completely different in Echuca, where there are co-appointments. And one of the reasons was Bendigo Health got too full. They wanted to attract these new specialists. So they went, oh, we'll give you a day in Echuca and a day here, and it's worked for both hospitals. In fact, we all know that rural obstetric delivery is a problem. Echuca is one of the only places in Australia that is increasing their complexity. They look like going from a level 4 to a level 3 centre. That is extraordinary. But also she's been involved in a regional skill set. She's got someone who's interested in ultrasound, someone interested in gynae-oncology, they're visiting, and someone interested in urogynecology. And this is my toy boy and one of my best friends, Tom Cairns. He was my fellow for 2 years. He's a gynaecologist. He's not really my toy boy. He's in Dalesford with his girlfriend. You're safe. But he wanted to learn how to do complex vaginal surgery, and that's something I'd done in my fellowship. And there was no one really doing it in the gynae unit. And unfortunately, you may not realise this, but the vagina's like North Korea, South Korea. It's the demilitarised zone, often between urologists and gynaecologists of who's doing what. And Nicola and I got together, and we're about to break down those barriers, literally, and train in O&G. And now Tom is the first ever gynaecologist employed in a urology unit in Australia, and he's also still employed in the O&G unit. And I think that's an extraordinary story. So the next one is research. And my pin-up boy is the famous Rob Bloom playing his piano. In 2003, he came here. I remember Rod. He was a registrar at Peter Mac when I was but a young third-year resident, and he was always a bundle of energy then. And he's here with Becky Chapman, who used to have a collection of tea cozies, completely bonkers, but one of the most beautiful clinicians and people you will ever meet. And when they came together, they thought, how are we going to build up this service? So they said, let's try and get a registrar, again, the recruitment piece, and the only people they could get were palliative care trainees. Now look where they are. We have 7 oncologists here. 5 of them were registrars at this hospital. They didn't come back here because the pay was better. They came back here because they had a great time. There are now 3 haematologists, 2 nurse practitioners. They have 2 accredited registrars for 12-month positions. You can't do any more than 12 months in one centre. They have a research manager. They provide regional outreach at Swan Hill, Kuranga, Tooting and Kyneton. And what is interestingly, though, those hospitals provide the chemotherapy. It's not, coming in overbearing. It is working in conjunction with our regional colleagues. And it's made research part of today's standard of care in oncology. I wouldn't go to an oncologist unless they're involved in research. So what is, again, the regionalisation effect? Eileen mentioned it. It's access to new treatments. They managed to use research to fund a fellow, 0.5. That fellow is Chloe Giorgio, who's now moved here as a consultant. They've got access to genomic evaluation, which we're never going to have in Bendigo. We don't have that laboratory support. It ensures the team remains up to date. It enables strategic relationships affording other opportunities. And what Rob says, being part of collaborative studies has given us kudos and credibility and afforded other opportunities. Once you get in the research space, it's kind of like you're in the playground and you're with the cool kids. And when you're with the cool kids, other things come. My third R is relationships. And this is Simon here, who's in the back, and I'm going to completely misquote you, Simon, so it's fine. And I'd like to say that Simon spent the whole time saying, make sure you emphasise Diana. Diana really set things up. And I'm pretty sure when you came, you were just 2 FACEMs. It was around about that year. I couldn't read my own handwriting. There was a consultant or GP on each shift. And now he tells me there are 32 FACEMs servicing Bendigo. 32. And 12 of those consultants were trained here. Is it 4 or 5 years? 5 years? 5 years with maybe 6 months in Metro, as opposed to the opposite. Same story as O&G. And many of these were students. There are now 4 consultants per shift. And as someone who's just had my demented mother in here, you're doing a great bloody job down there, can I tell you? This is an extraordinary story. And in fact, if you talk to the students, what Simon has done is they have a dedicated half-day teaching every Wednesday. The consultants run the department. Can I tell you how that makes a young doctor feel if your bosses are willing to... Like, those sort of little... It's not a little thing, but those things really make a difference. And now people are coming to Bendigo because they have the highest pass rate in Australia for the exam. That's what I'm told, not by you, but by others. And the key is, when you talk about Simon and the ED doctors, I used to go to Swan Hill and one of my friends was the ACRM running the ED, Emily Harrison. It would all be like, Simon's so helpful, Bendigo's so helpful. That's what we want to be. We want to be there when our regional partners need us, and we also want to be able to be flexible and go and help that. Which brings us to the regionalisation effective relationships. Simon's wife is a FACRM, and he's also done some GP work. They've trained 25 GPs with a special skill in ED. That is just extraordinary. That is what is keeping our patients alive. I was on a golf trip to Bendigo Dunes, which if you don't know where Bendigo Dunes is, in the middle of bloody nowhere. And I was there with, it's Australia's best golf course. I'm obsessed with golf. And it was in the middle of nowhere, and my best friend was there, and suddenly she had severe chest pain. And I'm in this, driving in the middle of the night in this place called, is it Scottstown? It's Scottsdale, I knew it was a dale, a town, a ville, with, one nurse, one GP registrar, and we can get an urgent troponin. I couldn't get to Launceston, I couldn't get to Hobart. These rural hospitals are essential. There's 12 months VRGP training as well as the physicians. There's VMO outreach to upskill to Castlemaine, Echuca and Swan Hill. And Simon wanted to say that every year they have 50 participants, GPs and also nurse practitioners and emergency skills. And he sent this to me after I ran a dinner about recruitment. I'd like to point out it looks pretty fun, although he does live at a vineyard. Here's a photo of the ED registrar lunch at my place. This is why the registrars feel supported and want to stay. And I have to be honest, I saw that photo and I thought, I'm giving up urology, I'm going to ED. But only if I can do the penis bit, so don't want to do the other bits. Okay, and the last one, of course, I'm going to talk about our unit, what we've done, because we're kind of small, we're not very famous. But I came here in 2010. Back then, you got your photo in your paper when you were a new consultant. I look back, I was going to put the photo up, but I thought no one will recognise me. I was skinny, I had brown hair, and I didn't look quite as jaded. But we had 2 consultants, 1 and 2 on call, and an intern. That's all we had. We now have 5 consultants. Now, one of those is, of course, a gynaecologist. He doesn't do on-call. The other 2, Tony Macris was an IMG. No one would come to Bendigo. We got an IMG. We trained him up as a fellow. He'd use the Australian exams. He lives here. Todd Manning has come here. He was our first ever accredited registrar. Don't tell me these things don't help. We have 3 registrars now, as well as a HMO and interns, and one is Set 3, which is actually quite senior in urology. Of course, we started at Set 1, and now we're the most popular registrar job. We have 3 nurse practitioners, which I think for that many consultants is a lot, and we are performing consulting and operating, so we can continue to keep the smaller hospitals' surgeries alive, which is so important that there are emergency surgical services at Echuca, Castlemaine, Kyabram, Swan Hill, Kyneton, and I've got my eyes on Mildura, and that is coming soon. But I talk about risk because these things have worked really well, but there's some things we did that didn't work that well, and I've got to actually thank David Rosea for the nurse practitioner piece. I'd done a fellowship overseas and I'd seen not this model but work very well with research. And so we started a nurse practitioner-led cystoscopy service. That wasn't, that revolution. It was probably at the time, but not that exciting now. But then we have an intravesical Botox service. That doesn't happen anywhere else in Australia. And we have Australia's first nurse practitioner-led transperineal prostate biopsy, because our attitude is always, I hope I'm a highly skilled surgeon with years of training. Why should I be doing something that someone else can do when no one else can do the nephrectomy? And we've got so much work, we've had to accept that model. And can I tell you, we've got a lot of flack from my Metro colleagues. How dare you have nurses performing these procedures when we have plenty of room to do them in Melbourne? And in fact, Dave, we often laugh, got the honourable mention in Australian Nurse of the Year, and Graham Campbell constantly likes to remind me that it's great to have Australia's second best nurse, and I'll take that any day. We've been involved in investigational device trials. Some here, I'm not going to lie, it's pretty tough to do research here, and I think there's been a change. We've done some up the road. The one advantage of being involved in trials, it's what Rob says, it's about credibility. And in fact, I got known, so I got invited to be on the selection guidelines for how to get onto urology. So suddenly I made lots of points if you did 12 months in a regional centre as an unaccredited registrar. And that's why we have 2 unaccredited registrars, and last year we had 45 applicants. Thank you very much. But of course, the one thing that we've taken a risk with is community fundraising, because community fundraising, it's pretty obvious. Like if you fail, it's really obvious. David Heath was instrumental. That's his photo there, our first nurse practitioner, getting funding for transperineal prostate biopsy back before it was cool, because it was safe. And so we raised $250,000 to get that up and running, and we've been doing that for years. And of course, I'm sure you know I'm pretty passionate about robotic surgery, and asking the community for $2.5 million, I thought, well, that's going to be a hard ask, but it will be announced next week that a robot will be coming to Bendigo, and that is very exciting. So, and to mention the fifth R, robotics, just to get it out there. Everyone thinks that I just want a robot to save my back and maybe make some more money, but in fact it's got nothing to do with that, because it's all about recruitment. 85% of urologists live in metropolitan centres. 87% of urology trainees do a robotic fellowship. You do the maths. We're not going to attract the next generation. All this work is going to be for nothing if we don't get more consultants. And if you think that's far-fetched, I ask you to look at our ear, nose and throat service. Nalu Havia gave years to this place. We then recruited from South Africa, we recruited from the UK. We still have no public ENT service, although we do have some private work, which is, I don't think, where it's at. So this is why it's so important. So I think I've shown you that the vision of regionalisation isn't far-fetched. And in fact, we've already got people showing you. And what's interesting about all these stories, if you think about it, they are all the four pillars. They all involved recruitment. They all involve research. They all involve relationships, people wanting to stay. And someone in executive and on the board level had to take a risk to make these sorts of things happen. There is no great reward without risk. Ask Jack Nicklaus, that's how he designs his golf courses. So, there are some headwinds. I'm not going to lie that it's all easy. The first is competing priorities. Many of my colleagues are focused just on service delivery versus a long view. I mean, one of the criticisms that Ava knows is, I hate our motto, excellent care, every person, every time. I don't think that's a stretch goal. If I don't come to work and go, you know what, I might provide average care some of the time to some of the people, I would suggest that's what we do. That is our baseline. We need to do more. We need to be more ambitious. And patients versus staff. We're going to have to make difficult decisions. Sometimes in supporting research and recruitment may mean that for a period of time, proof of concept, there'll be less money for clinical service delivery. This is a difficult tension in these financial times. There can be distrust from our regional partners. It'd be fair to say as a regional hospital we've been colonised from our metropolitan colleagues. In fact, our surgical registrars come here from Western, Austin, Eastern. We don't get any say who gets on the program. It's the same for our medical registrars. The danger is that the colonised, i.e. us, don't want to become the colonisers of Swan Hill, Echuca, Kyabram and Mildura. We need to be respectful of those partnerships. Geographical narcissism is alive and well. We all know the inverse relationship. The further you move from Melbourne, the dumber you get. And if you think that my medical colleagues don't believe that, then you're living in la-la land. Risk aversion. We are so worried about what people will say that we don't take risks. And I think it's a particular problem in research. It's really obvious if we stuff up a research trial, but it's not as obvious if we miss doing something important that could change someone's life. And so we have to really think about what we're missing out. And finally, we will make mistakes. And you better slip over this slide quickly because I'm not controlling it. Cheers. Okay, next. That's an in-joke. So how to make this a reality? Well, the first thing is to remember that what we're famous for is silos. This is the Nullarbor silo, this Northwest Silo Trail. I would contend that we are an immature health service trying to provide tertiary level care. We've been a small hospital with small units that really ran it like a VMO private setting. We don't have all of the infrastructure to make it work. I don't think we have enough meeting rooms to be able to conduct research. There's no offices for our juniors. The hospital is so well designed for patients, not necessarily really well designed for doctors, I'll be honest. Controversial but true. And I think we need to think about ways of breaking down those silos. We don't have grand rounds. We don't have those sorts of shared things that have been done for years elsewhere. And finally, I want to propose a question. I played tennis as a kid. Who played tennis as a kid? Yeah, nearly everyone. I grew up in Ararat. Of course you played tennis. There was nothing else to do. Play tennis or sleep with boys. I chose tennis, which has gone well for me in my career. So do you remember at the end of tennis practice, the balls would be everywhere and you'd have to go and pick them up? So there's two ways you could do it, yeah? You could go from ball to ball to ball to ball to ball and pick them up and put them in the coach's thing, or you could hit them all to the net and then pick them all up at the end. All right, I want to show hands again, a bit of participation, play school here. Who thinks that going from ball to ball is the best option? Ooh, controversial. Who thinks that kicking them all to the net is the best option? Oh, we've got a lot of nets here. I'm going to tell you some physics. Going from ball to ball is the quickest. Hitting them to the net is fabulous if you don't want to bend down. I don't like bending down, I've got a bad back. But if your vision is different to my vision, we're not going to agree on our strategy. So the first thing we need to work out is what our vision is, and I think that's what sometimes holds us back. So finally, to end with regionalisation, I've given you the 4 R's, the 4 pillars. Risk, research, recruitment and relationships. And who doesn't like 4 pillars? And if anyone doesn't like 4 pillars, I'll talk to you about it later over a G&T. And finally, in the words of one of my great mentors, anything is possible, particularly if you are curious, Eileen. Anything is possible. So I encourage you to believe. Thank you.
That was fantastic. And that's in a day of consulting and surgery and in theatre, in operating. So thank you very much, Janelle, and it's really inspiring. And also thank you to all the amazing staff we have here. Because as I said before, the service isn't just the buildings and the buses and the consulting rooms. It is the people that has made Bendigo such a fantastic place to live and work, and for our service to be so good for the community. So thank you very much, and it's very inspiring. So next, I'd like to invite up Dr. Stan Capp, the Chair of our Finance Committee, to talk about finances. Also very inspiring.
Well, I can see you're all on the edge of your seats now. What you're going to come up with, the better's the previous speaker. What a wonderful speech, and thank you so much for your inspirational work and what you've delivered to date. So thank you. Turning to the riveting subject of money, for the financial year just ended, our turnover was $786 million, which was a 3% increase from the $765 last year. And that reflects largely the growth of the health service, but also reflects some change in cost structures. Now, this slide is a snapshot, the financial position for that year, and in fact a couple of comparators there which you can read for yourself. I'd just like to highlight that the net operating deficit, the second one down, whereas we've always had positive figures in those columns, for the last financial year it was a net operating deficit of $16.1 million in a year of increased activity but also increased cost of care. So whilst that's disappointing because nobody wants to be reporting a deficit, ironically I can tell you that it's one of the better results across the larger health services in Victoria, and so we should be pleased with that. And indeed the proposed deficit that we should be shooting for from the Health Department and the government was a net operating deficit of $20.4 million. So we actually improved upon that. But that's a challenge that we have, and we have another challenge leading into this current financial year, which I know everybody in the health service is concentrating on and is aware of. Our net assets were up to $1.5 billion at the end of the financial year. Now, if you look at that, it was $592 million, so that's not a bad thing. It's called revaluation of assets. We actually didn't spend on new assets that way, but the way the accounting system works, that's a reflection of the revaluation of land and building values as provided by the Value General of Victoria. So we did receive funding that enabled us to undertake a number of initiatives. We had an improved hospital access and patient flow through initiatives like the Timely Excellent Care Collaborative, which many of you in the room will know and be proud of the work and results that have been achieved through that initiative. We've reduced the number of patients waiting for elective surgery while responding to the large volume of emergency surgical cases presenting in our hospital, and we continue the work of the Public Health Unit in developing community partnerships to educate and inform people on how to stay well. So a quick glance at the growth in activity numbers, and Eileen covered some of this off in her remarks. 57,000 admitted patients were treated, an increase of 5% on the prior year, and the number of service events at our specialist clinics also grew by 5% to 135,000. This is clearly a reflection of the continued growth that we experience, and this is largely organic growth. There were 61,000 emergency presentations, which was marginally down on the previous year. And whilst that was marginally down, it is, I think, a good reflection of the successful diversion to the priority primary care centres. Interestingly, the reduced numbers also reflected an increase in the complexity of presentations, which has increased, which led to more inpatient admissions, as well as an increase in emergency surgery procedures of in fact 7%, for a total of 4,800 emergency procedures. Ladies and gentlemen, I just want to continue. I have 140 pages in the annual report and the financial statements, and I'm sure you'll be pleased to know that I've finished. But I would like to say thank you to the CEO, Eileen, for her work, and CFO Cameron and his team in supporting the work of this organisation through very challenging times financially. I note the support of my fellow directors, and in particular I'd like to recognise the contribution of our Chair, Eva Pacho, who is without doubt an outstanding example of a person who has come from a clinical background, who is committed to every facet of this health service and gives enormously of her time to make it all work better. So thank you, Eva. Now, on the basis that I don't anticipate there will be any dissent, I'm going to move the financial report as detailed in the 23-24 annual report be accepted. And is anybody prepared to second that motion? Thank you, Trevor. All those in favour? Against? There is no dissent, and I thank you all for your spontaneous approval of that. It's my pleasure now to introduce Trevor Elliott, who in his short time relatively on the board has made a huge impression in terms of his contribution at all sorts of levels, but none better than in the area of fundraising and managing all of the other peripheral activities that just might contribute to some of the goals that we heard in terms of robotic surgery. So could I just invite Trevor, please, to come forward and give us a report on fundraising at Bendigo Health.
Thanks, Dan. Very hard acts to follow today, so I will do my best. As Dan mentioned, so the purpose of the fundraising department is basically, as Finance just mentioned, the times are tough with the funds, so all of those other bits and pieces, equipment, trials, education, that's the purpose of the fundraising department, to be able to raise for those items and be able to provide that additional services that Bendigo Health wouldn't otherwise provide. So in 2024, we raised $2.2 million, which exceeded the budget of $1.7 million, which was a great effort by the team. Strategic focus, we've got a strategic plan which we set in 2023 and goes to 2026. And in that plan, the main areas are to provide, as we mentioned, provide specialised equipment and services, low-cost accommodation for patients and families, and scholarships and training to build on the exceptional regional workforce. Key investments have included $440,000 on specialised equipment, over 2,000 items on clothing and underwear for patients in emergency situations, and $216,000 was allocated to the Go Bay Wellness Centre, just 50 metres away, so which was great. Now, some of that equipment, included a Atom infant warmer, which supports critically ill newborns in the emergency department, iPad trolleys facilitating access to online Auslan interpreting services, a new fish tank for the children's ward, and a scalp cooler helping cancer patients reduce hair loss caused by chemo. We've also got a commitment to paediatric rehabilitation, and that is a new playground in the front of the clinical services building. We've raised $700,000, partly from the Royal Children's Hospital Good Friday appeal. They've allocated us some funds, but also through our Christmas appeals of previous years. So we're looking to, we would have loved to have had broken dirt by now, but we're certainly looking to do that in the very near future, which will be a great move. In the mental health space, last year we did the 24-hour treadmill challenge, which raised $70,000, and that, again, the allocation of that was for, among other things, a new 12-seater patient transport bus, which enables the patients to be able to travel out for outings for the day and access exercise programs. And also the dual diagnosis unit, thanks to Sue Giroux, we had an upgrade of all the decor and furniture there. The fundraising department visited there a couple of months ago and it looks fantastic, so another great initiative. Community-led fundraising, we're very, very fortunate for other people to do some of the work for us, and two of the major ones there are the Bendigo Forward Fun Run, which last year raised $60,000, and that went to the kids' play space as well. And then there was the Gala McKean-McGregor Ball, which raised $254,000, and those funds can go towards the Go Bay Wellness Centre running of that each year. Just lost my spot there for a moment. Moving on, so supporting education and training. We had some scholarships. Harry Pearce, our operating theatre technician, used his scholarship to pursue a certificate in management and leadership. And Sandra Lucci, health administration, formalised her 10 years of experience with a certificate in health administration. We also invested in 8 paediatric focused scholarships worth $10,000 for nursing and allied health staff. Good Friday work builders thing. Just a few thank yous to finish off. I'd like to thank the fundraising advisory board members who we meet once a quarter and give guidance to the team. Sincere thanks to our community, corporate partners and funding organisations for their generosity and continued support. A special thank you to our platinum sponsors, Exemplar Health, Bendigo Bank, Bendigo Toyota, Agnico Eagle Australia and McKean-McGregor. I'd also like to acknowledge the support of the Bendigo Healthcare Group Foundation charitable trustees for their diligent management of the funds. And finally, I'd like to extend gratitude to all staff, volunteers and auxiliaries who contribute through in-kind support, donations, sponsorship and fundraising efforts. Thank you. And now I'd like to introduce Umair Masood and Carol McKinstry to present some awards.
Now for the fun part, celebrating our staff and their achievement. This is my 9th year being involved in the Excellent Care Awards, and it's an absolute joy every year. Bendigo Health has a long and proud history of identifying opportunities to improve the quality of care that we develop to our community. Our annual Excellent Care Awards showcase the very best and innovative ways our organisation has improved care. And for both Carol, the board, and myself, it's an absolute joy to be involved every year. It gives us great pleasure to introduce the 6 finalists for 2023's Excellent Care Awards. I think the slides might come up, hopefully. So the first one is access to specialist paediatric dental care. So dental problems are common in children, with 42% of primary school-aged children experiencing tooth decay and 33% of these children experiencing dental trauma. So this gap was identified, but there were no local pathways for children with particular needs to have these needs met. So to address this gap, a specialist paediatric dental program was established. This involved the appointment of a specialist paediatric dentist, training for staff, development for referral processes, working with other departments, funding and ordering of equipment, development of processes and protocols, and also undertaking an audit of the first 50 sedation cases that they had. The outcomes have been that 331 patients have been sent over 575 appointments. Except in the case of orthodontics, the need to travel to Melbourne has essentially been eliminated. So as well as the elimination of unsuccessful treatment with the ability to escalate for further sedation, and finally, positive feedback from families and students with increased retention of staff as well. Okay.
So the next project is implementing tests of change to reduce ED length of stay and improve patient access to timely care and medical services. So there's been increasing pressure on the health system, I don't need to tell you about that, to ensure all patients have timely access to their required care. To address this challenge, a number of teams at Bendigo Health committed to undertaking improvements to reduce length of stay and improve access. And there was a number of initiatives undertaken, including increasing including the hours of the discharge lounge, introducing a care coordinator to assist with transition to aged care, day zero mobilisation of orthopaedic patients, the introduction of a golden ticket, early morning discharges, the introduction of a nurse to commence treatment in the ED waiting area, and the facilitation of direct admissions to the short stay unit. Key outcomes of this work were the sustained improvements in the length of stay and increased in early morning discharges and increased availability of beds. So this project went a long way to helping ease some of the pressure on the emergency department through looking at a whole range of other initiatives as well. Thank you.
So the next finalist was new models for new patients' cancer services. Cancer services found that their central intake processes lacked structure, and patients experienced variable navigation support on entry to cancer services, depending upon the tumour stream that they were involved in. So oncologists employed at the cancer centre were working long hours across outpatient clinics, visiting outreach clinics, covering inpatient workload, and trying to fit in triage for new referrals into the end of a long day at work. So the cancer services team saw the opportunity to improve the service delivery on entry to the service by introducing a new central intake cancer nurse coordinator and redesigning the new patient oncology clinics. The key outcome of the redesign have been reduced barriers to access with the key contact for the patient, along with improved referrals, coordination and support. System benefits included time saving for clinicians of about 1.5 to 3 hours per week on triage duties, reduced wait times for first appointments, improved ability to utilise appointment spots in events of cancellations, and improved GP interface for referrals as well, and also earlier, more timely referrals to the broader team, including the allied health.
The next quality improvement project, the Curran in-language breast screen bookings. So over the past 10 years, in-language education sessions and group bookings have been held in collaboration with Bendigo Community Health Services. However, with the continuing increase in the local Curran population over these years, these sessions were no longer an efficient use of time, nor were they reaching all of the community. Feedback was obtained that although newly arrived refugees were being assisted to book breast screen appointments, the use of the national relay service for translation was very cumbersome. So working alongside one of Bendigo Health's current interpreters, an administration officer from Breast Screen was able to work through the booking process. A mobile phone with current text characters allows text messages to be sent in language if needed. In the first 2 months, 26 clients were identified for contact, 15 were contacted and attended appointments, 1 declined and 2 were identified as duplicates, and 8 unfortunately were unable to be reached. Follow-up is being conducted with the GP to check contact details with some success. So having the interpreter service work with the team, this has increased understanding of the barriers to accessing services.
So we move on to the next one, which was the transition from Heart Helper program to ENs. The Heart Helper pilot identified the need for rapid follow-up and additional home visits and support in the community of heart failure clients with the aim of reducing 30-day all-course readmissions. With the successful completion of the pilot, with a reduction from 30% to 14% in readmissions, the Hospital Admissions Risk Program, colloquially known as HARP, identified the need to continue the concepts established during the pilot. A new model of care involving an increased scope of practice for enrolled nurses working in the HARP team was developed and implemented. The outcomes of the new model of care have been demonstration that the ENs in HARP are cost-effective adjunct to the HARP team and enable the care coordinators to manage their workloads effectively whilst having greater client contact. The EN job satisfaction has also increased, and their scope of practice is expanding further to include patients with other chronic illnesses as well.
And the last project was the virtual tour of the Bendigo Regional Cancer Centre. A former patient and consumer representative for cancer services, patient consumer representative for cancer services, raised the need for more information and support for new patients and proposed an onboarding video that could support information and navigating services at the start of the cancer journey. Through a broad consultation of consumers, this validated the challenge that patients newly diagnosed with cancer faced, and from a seed concept, co-design project, this was funded by the Cancer Centre. The outcome is a resource for our new patients, our families and carers at the start of the cancer journey, and this enables individuals to find their way or be assisted for them to understand what to expect, and may lead to reduced anxiety and before arriving at the cancer centre. So the virtual tour resource QR code is incorporated into patient information at the first referral and is recommended by the Central Intake Cancer Nurse Coordinators at initial contact prior to attending the first consultation. The project itself has built capacity in the local cancer workforce to engage effectively with consumers, carers and consumer representatives to collaborate in this co-design project.
So we're going to announce the winners. So firstly, we're going to start with the honourable mentions, and I might stop at the end of each so that you can hand out the awards. So we congratulate the Breast Screen team for their project to improve the car and in-language breast screen bookings. Eliza Alford. And also the HARP team for their work to transition from Heart Helper program to ENs. I think it's Carmel Byrne and Hannah Graham. And in third place, we congratulate the medical services for their project that addressed implementing test of change to reduce ED length of stay and improve patient access to timely care. Melinda Bowen. And in second place, we congratulate Cancer Services for their new models for new patients in cancer services, Melissa Loram and Chris White. So we've got a first, in the 9 years that we've been doing this, we've actually got joint winners. After much debate, we couldn't really come up with a clear winner, but that's not a bad thing, really. So we congratulate Cancer Services winning with their project that was initiated and led by consumers to develop a virtual tour of the Bendigo Regional Cancer Centre, and Dental Services for improving access to paediatric dental services. So Melissa and Diana. So we just want to congratulate all the winners and also all the finalists this year. And hopefully next year is going to be just as good or even better. Thank you.
Thank you very much, Umair and Carol. And I've got to say that it was very difficult to each year it gets harder and harder to pick through all the finalists, because all the projects are very deserving, and I thank everyone for their time and effort. Well, that brings us to the end of our AGM. Once again, I'd like to thank Janelle Brennan for her inspiring speech. I'd like to thank my board members for all their time and their effort that they give and all the support they provide me as chair, and also the work that they do as chairs of their respective committees. Eileen Hannigan, our CEO, and the executive. Again, very hard-working team, all love to work with them and work together, and they put in many, many hours. And everybody that's here today, all the staff, the volunteers, and our colleagues in other health services and our partners for what they do. And finally, thanks to the team who put on the AGM, got everything sorted, for all getting the nice yummy food out for us now, but also for arranging it and sending out the invites and bringing you all here today. So thank you for your time. Please join us for some refreshments, chat to all the finalists. Please feel free to come and speak to the board members. You can grill Stan on his finances. And thank you, and we'll see you next year. Thank you very much.